professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Good evening. Good evening to Your Health Matters. This is Dr. Gerald Thompson, and it is certainly a pleasure being with you once again. I was at an event, well, a funeral this evening, and I ran into a couple of individuals, Mr. Davis and other individuals who listened to the program, and it's certainly a pleasure. As a matter of fact, as I go around the country, a fair amount of people say they listen to the program electronically. We may not see this recorded, on live and so forth, but people are turning on their radios and so forth and listening. So that's really wonderful. It's certainly a pleasure to be of some service to you. This evening, I've got to talk about something called HMPV. What is that? HMPV. Well, it's a virus that is making a surge in China and Southeast Asia right now. And of course, because of global communication, there is some concern as regards if this is going to be another pandemic, if this is going to be another COVID-like type of situation. And I want to talk a little about this because it is true that right now in Southeast Asia, led by China, that there is a surge in the number of cases of HMPV, human metapneumovirus. Sounds strange, eh? It really sounds strange, eh? As a type of illness. Human metapneumovirus. And what does all this mean? Let me tell you, folks, there are literally hundreds or thousands of different viruses that can affect the human being. Some viruses, the majority of them, love to get at your respiratory tract, your nose, your windpipe, down into your lungs. That's one of the weaker entry points into your body, breathing in air. So as you breathe it in, you may be breathing in some virus that's attached to some droplets that someone has coughed or sneezed or something in front of you, just like what we learned with COVID. But these viruses, they could be the flu virus, they could be ordinary viruses, like, well, I could give you some names, respiratory syncytial virus. You ever heard of anything like that before come out? RSV, respiratory syncytial virus. Well, you don't even have to know those names, but I could prattle off the names of dozens of different viruses that affect people. And at any given time of the year, there are different viruses in different places. There are some viruses that are peculiar to certain parts of the world and other viruses that are peculiar to yet other parts of the world. Now, there are other viruses like dengue and chikungunya and Zika and yellow fever. We've heard about some of these diseases are actually present in North America, in South America, I should say, Central America. They didn't originate here, although yellow fever and dengue were here for sure. But viruses like chikungunya and Zika came in from other places. And there's all sorts of different things. 2024 was the biggest year of infections for dengue ever. The biggest case. Luckily, St. Vincent and the Grenadines has had some cases, but not a big surge. And we've only had one death one single death, whereas 7,700 cases of dengue's death occurred around the world, or I say in Latin America and the Caribbean. Now, this virus, HMPV, human metapneumovirus, which I refer to as the virus, guess what? It's not new. It's been around for decades. And every now and again, you see a couple of cases in England and a couple of cases in certain parts of Europe. You see a couple of cases in Southeast Asia. This year, there has been a step up, a surge in cases. Let me give you an example. China certainly has an outbreak, but India has reported 9 cases. Now, I didn't say 9,000 cases. I didn't say 90,000 cases. I said 9 cases. Normally, they might have 1 or 2. You understand? Kazakhstan has had 30 cases. This is a little bit more than what they've had in the past. Now, Malaysia has had 327 cases. That sounds like a lot to you? Come on, does it sound like a lot to you? 327. That's 45 cases more than in 2023. You know what I'm saying? England has had cases in the past, but guess what? This year, in the UK, in certain parts of the Americas, in Florida, they're seeing an influenza virus that's causing a problem. Even in China, let me put it this way. In China, influenza is the virus that has been causing respiratory infections in 1/3 of the cases, 30%. In China, where we concerned about a rise in HMPV, guess what? It's just 7% of the respiratory cases. You understand? So, public health officials and regional officials, the World Health Organization, our regional organizations, CAFA, and our national body is monitoring this situation to see if it gets worse. But there hasn't been a rapid spread of these cases to the Western world. It's still in Southeast Asia and Asia, India, Kazakhstan, Malaysia, and of course, China. Everybody clear? Now, what is this illness about? If it does come here, there's nothing wrong with sounding the public health alarm to some degree. I know some people say, aha, they're trying to trick we again. They're trying to trick me again, so we go and wash our hands, that we'll go and stay away from crowds and, and anybody who coughing. What's wrong with somebody coughing in my face and me inhaling the respiratory droplets? Nothing wrong with that. Matter of fact, it's good if I catch it now, if I catch something now. Therefore, it'll make me immune to whatever I'm catching. Well, boy, what is circulating right now is a kind of a bad influenza. It isn't this HMPV here in the Caribbean. We haven't had those cases. We've had other viruses, Now, I must tell you that at the age of 19 plus, I went to England. I left St. Vincent, went to England. And my first real job, I got employed at University College Hospital in their virology lab. They taught me how to use the electron microscope to see viruses and other things that close up. I'm talking about 1977. But I'm going back some years, boy. I tell you how old I am, boy. I tell you, and Kamal, I studied microbiology, and later on I went on to do internal medicine. I went on to study infectious diseases, allergy, immunology, did a master's in public health, that. The point is, way back then, I was using the electronic microscope, but to find out what kind of virus something was, you had to take some blood sample or some tissue sample. Somebody's cold that they hark up, or some blood from their veins. And you used to have to try and see how you could enhance the virus for a couple of days. And then after that, we would then put it into some special tissue media to see if it grew, and then look at it on the electron microscope. 3-4 days would go by. Suppose the virus is causing a whirlwind, a storm. You got to wait 4 or 5 days to try and identify what it is. Today, we have these blood tests where we can just draw a little bit of blood. We could even prick your finger, get a little bit of blood. And we could actually test to see, is this influenza? Is this Oropoucho virus? Is this dengue? Is this? Is it that? We can find out. And then we can also do something called PCR. But these rapid tests I'm telling you about, you get the results back in 15, 20 minutes, not 4 or 5 days. And the PCR might take a couple of hours. But it's amazing how we are able to make a diagnosis so quickly. Now, the problem is that viruses still don't have much in the way of treatments. You know, we don't have good antiviral. So even though we identify what kind of virus it is, the best thing is prevention. Prevention is better than trying to cure when you don't necessarily have a cure. And I have to tell you a little bit about prevention, because prevention starts not only with you not getting it, but if you have a cold, if you have a flu, if you have any kind of viral illness, it is your responsibility and your duty to try and protect other people too. You have to protect other people from spreading. So if you have a virus, you have a viral illness, you should wash your hands. You yourself should wash your hands. Because if you go and touch somebody else, or touch a doorknob, or touch something, touch a cup that someone else would have to come and touch that cup, you could be passing on that virus to a person. You know? You have to try and get better quick. The best way of getting better is fluids, water, pure, clean, and safe. This is some of the best water. Not to drown yourself, but drinking nice, lots and lots of water to help to bring down your temperature, loosen up your phlegm, you know, and hydrate you. Don't become dehydrated. That's when things really go bad. And get some rest. And let me say, don't go off to work. Don't go into a crowd. So you, as a person, have a responsibility. Now, for other persons who are not ill, when you hear these public service announcements, you too have to wash your hands. What's wrong with washing hands? Is there anything wrong with washing hands, Kamal? I mean, is it a burden on our society? Does it raise up your water bill? And so, does it raise up your water bill so therefore you can wash your hands? Just simply washing your hands. And then if you cough, you know, cough somewhere, you know, in your armpit or your elbow or something, like if you don't have a rag, but it's good to have that. And then for those individuals who want to wear a mask, no problem. Do that. Somebody might laugh at you, but guess what? Protecting yourself is come on, if you saw me wearing a mask, you would start to laugh at me, right? No. You think I'm old school. Huh? He said yes. But the thing is that it is so important you have an understanding that when the public health people sound any alarm, that they're not trying to fool you. They're not trying to trick you. They're not trying to prevent you from going to the supermarket or going to a show or keep you indoors or want you to stop working or what. No. It's that it's important that they put out the public service announcements and that they keep on putting it out until any warnings or any threat is over, you know? And then guess what? Another virus is going to come along. Another virus is going to come along. Now, this human metapneumovirus, this HMPV, loves winters. We're lucky. We don't see this virus that much because we don't have winter. You know what I mean? Although if you were to go up to Soufriere right now, right, at night, it'd be a little cold, right? There's some villages and so in St. Vincent that also get a little bit cold to a night. I'm not going to say any names. No. I'm not going to say any names. And then the important thing is for you to understand symptoms. Let me give you. All viruses tend to cause the same kind of thing. Look at this. All these viruses, these respiratory viruses, flu, respiratory syncytial virus, RSV, all of them cause around the same. They cause a runny nose. They cause inflammation in the nose. They cause a sore throat. Sore throat. In causing a sore throat, you might have a cough. If the inflammation is going down into your windpipe and your bronchus, therefore, it's going to give you an inflamed throat, so you have a sore throat. As it goes down your windpipe now, you can start having a cough. And if it goes down further down into your lungs, then you're going to have maybe bronchitis or pneumonia, right? Typically, you can have a high temperature. And we love to say, do you have a slight raise in temperature? We call a low grade fever. Or do you have a moderate grade fever, 102, 102.5? Or do you have a high grade fever, 104, 105? You don't want high grade fever. And especially young, tiny kids, they must not have temperatures over 105, 106. They will be starting to fry. They will be fried, with those temperatures. That's why we tend to give them medication to keep down the temperature. Panadol, Tylenol. We get cold rags, put it under the arm, around the neck. You see films where somebody has a fever and they put in a cold rag on their forehead to help cool them down a little bit, to keep the temperature from rising above 104, 105. You don't want them kind of temperatures. You don't want your blood boiling. You don't want your brain frying. You don't want them kind of temperatures. Much less, you don't want temperatures of 107, 108, 109. Those temperatures are not compatible with life. You can't have that, those kind of temperatures and live long. So bringing temperatures down, putting people on the cold baths with ice to keep the temperature down is important. But so when the infection starts to really get down into your lungs, you start having difficulty breathing. You may have the cough may have phlegm, coal. The coal may be white, maybe yellow, maybe green. When you see green, it could be virus. When you start seeing your phlegm getting yellow, that sometimes means there's bacteria inside it. And worst of all, if you start seeing blood in your coal, in the coal you're hacking up, you got to go to a doctor straight away. You don't want to see blood inside there at all. That ain't so good, right? If you have inflammation down in your chest, your lungs, you could be also having chest pain, shortness of breath. You could feel tired, fatigue, malaise, because your muscles are also now getting inflamed. The high temperature that you have makes you tired and fatigued. Part of the reason is you're steaming off all your water. You're becoming dehydrated. Your throat's going to get drier, and your blood ain't got enough water in it to cause it to circulate the blood properly. Your blood is now thicker because you're dehydrated. You need to basically drink fluids. And you know, feeling tired, sometimes if the lungs are really bad, you start wheezing. Let me say that these are symptoms that many viral illnesses could affect. But this human metapneumovirus is causing similar symptoms. If you have those symptoms, hearing symptoms right now, it's not going to be human metapneumovirus. It's like to be influenza. It's like it to be some other kind of flu. It could be one or two or three of them circulating at the same time. That's what these things are all about. So one of the important things I'm trying to point out is that, yes, there's a part of the world, a region of the world, where there's been a surge, an increase in the number of cases of this virus. As I said, in Malaysia, there's 45 more cases last year than the previous year. 45. I'm not saying 40 million. I'm talking about 45. So there's a slight increase, right? And in China, we see pictures of people in emergency rooms and so, but guess what? Some of those people in the emergency room, they may have the HMPV, but many of them also have influenza, the influenza virus. Now, let me tell you, this happens every year. Flu is a virus that loves to mutate. It loves to mutate. And when it mutates, more people are able to catch it. The virus starts to spread to places like India, then to Persia, that's to Iran and Iraq and those places, then across the Mediterranean to Italy. From Italy goes through to Europe, reaches France. From there, it goes over to the United States, Canada most of the time. From France, though, it comes down to Martinique. When it hits Martinique, then guess what? It goes up to Dominica, goes to St. Lucia, St. Martin, and then it comes here to St. Vincent. That's usually how we get it. Another route is somebody who is in Southeast Asia gets on a plane. Suppose they were in Thailand. Suppose they were in Thailand last month and they come back to the United States and then to St. Vincent. They could be brewing a virus. Now, I may have slipped. I was in Thailand last month and I wonder if I brought back HMPV to St. Vincent. No, I didn't. I didn't because I wasn't sick. I was fine. Now, it's true too, though, a lot of people who catch the flu, who catch these viruses, catch HMPV, they're asymptomatic. They don't have any symptoms, but they could still spread it. Or if they have a mild symptoms where they have a cough, they cough, they're on an elevator or they're in a room and so forth, and things could spread that particular way. Now, it's really important that we stress again that this HMPV virus has been around for decades. It's not the same as COVID. The COVID that we just went through 3-4 years ago was a new virus, a very new virus. And many of us had not been exposed to it before. Many of us were not immune to it. But this HMPV has been around. It's done its turn. It's gone around a couple of cases here, there. It's been around. We know about it. We can recognize it. We can test for it. and so it's not something that one necessarily needs to be very alarmed about. We just have to allow the World Health Organization, our regional organization, CAFA, we got to allow PAHO, we got to allow our national monitoring unit in Civil and Ministry of Health to watch these things and to alert us if things are getting worse. They must do this. A lot of people, once again, will say that, you know what? They keep crying wolf. They keep crying wolf. So anytime they mention about the virus, I'm not believing them. We do this every year with hurricanes. I would just say this got a tropical storm and I ain't see no storm coming. Or hurricane will come our way and next minute hurricane ain't pass. It go north. It go somewhere else. Well, that happens. But suppose they didn't inform you at all of the hurricane. Suppose they themselves said, man, this is probably nothing. And they ain't say anything about it. And then the storm comes in the twinkle of an eye and in the wee of the morning, And what, similarly, if they don't say anything about viruses, they don't alert us. They don't alert us 2 weeks, 3 weeks beforehand. So we can prepare properly. We could monitor things. We could make sure we have the tests, make sure we have stocks of things. And so in case, because if these viruses get away, it can cause a lot of problems. I think we have a call there. Did we miss it? Okay, the person that you would like to call back, And, viruses seem to be a big mystery. And I can't help but repeating myself. There are hundreds, there are thousands of viruses that can cause respiratory illnesses. If you are a person who lives in the northern hemisphere, where colds are and so forth, then where it's very cold in winter, during winter, you're indoors. Heat is on, you're dehydrated, you're breathing in the same stale air. There's a higher risk of catching colds in these northern countries. If you're from from China, because guess what? In Hong Kong, they hardly see any cases of this HPMV. They're seeing influenza, the flu. Whereas in the north of the country, of China, that's where they're seeing more cases of this HMPV. But the important thing I want to say is that almost every year, there are these viruses that can start off in pigs, right? We call these typically swine flu. The influenza virus could start off through swine. Or sometimes the influenza virus could start off through birds, and we call this avian flu. Avian flu. You heard the term before? Avian flu. And then sometimes the flu could start from some other animals and then spread to humans. And then as humans travel, as the virus itself travels from one person to another, or if the virus is able to leapfrog by some people jumping on a plane, leaving one location, traveling to London, to Heathrow or Gatwick, jumping on a Virgin Atlantic plane and landing in St. Vincent, or reaching on a JetBlue to New York and coming to St. That's a bit of leapfrogging. But normally it's going to go through the various countries. It's going to go through from China to Kazakhstan, to India, to Iraq, to Italy, to Germany, England, France, and so forth. That's how it's going to go. Right? Now, I'm going to take a little break for our sponsor recognition. We'll come back and we'll talk a little more. And if anybody wants to make a call or so, you can certainly please do so.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, and once again we are here. Now, I've been making the case, and over the years I've realized a lot of people do not understand what a virus is and what viruses are. I want you to understand viruses can affect plants. They can affect banana, black sigatoka, muco. All these things are viruses. Viruses can affect citrus greening. You know, are we losing a lot of our citrus? And so, virus can affect dogs. You know, dogs catch measles too. Measles is a virus. Dogs can catch measles. Dogs can, and cats could catch different illnesses. And so birds can catch various viruses and so. And humans, we are susceptible to certain viruses. Now, the truth is that young kids and more older persons are more susceptible. A person like Kamal here, who's strong, you know, fit, everything like that, viruses typically may not affect him to that degree. But young kids, on the age of 10, on the age of 6, even babies, infant babies, 6 months, 1 year old, all that kind of stuff, they are at risk of a lot of disease. That's why we give them vaccines to prevent chicken pox and mumps and measles and rubella and polio, because they used to kill, those stuff used to kill a lot of people long ago. You know, in the 60s, we used to, well, I'm currently on radio, so let me call persons back, but in the 60s, do you know the death lifespan for countries like St. Vincent was under the age of 60? It was no more than 50 something years old, you know? It was no more than 50 something years old. Whereas now, the average lifespan of someone, the average lifespan of somebody who is, of somebody who is female is 74 years old. And for a male, it is 72 years old. In other words, lifespan, people are living at least 12 to 15 years longer than they did 50 plus years ago. That's because a lot of infectious diseases have been dealt with. Let me remind you, penicillin was invented in 1930, but didn't go into use until 1945. In other words, penicillin is really only about 75 years old. And when penicillin was introduced, do you know what? Lifespan jumped 8 to 10 years. just from penicillin alone. In those days, someone would get a sore throat because they had rheumatism and they had a strep throat. And do you know the strep throat could kill them? The strep bacteria could get into their body and go up to their brain to cause meningitis. It could go to their heart and cause problems. It could go to their kidneys and so forth. And by giving penicillin that killed the strep, it helped to save lots of young little children who would have died at the age of 2, 3, and 4 years old. You don't see that anymore because we now have even better antibiotics than penicillin. You know? Unfortunately, viruses, we don't have treatment yet. We do have some treatments, but the treatments are usually really rough, toxic. Those treatments, you give them that they must kill the virus. But at the same time, some of those treatments can do some collateral damage. Let me put it that way. But because you won't kill the virus, you know, it's like a bird, something dangerous is flying around, and you decide, I'm in a studio and I'm pelting bullets, and so I shouldn't say that, but pelting bullets at the flying object, the bat or whatever, and I'm hitting some of these computer screens, but I eventually kill whatever is flying around, but I've caused some damage too. I feel good that I've killed it, but I've also caused some damage. Somebody has to pay for that damage, you know? Your body's going to pay for that damage. Now, I'm saying all this because our understanding of illness is not as sharp as it really should be. You know, we've seen this in our agriculture where viruses, I mentioned Black Sigatoka and Dofa, and we sometimes are the persons who are helping to spread these things around. And when it came to COVID, when it comes to flu, when it comes to all these kind of illnesses, these respiratory illnesses, because we don't adhere to good public health, we help to spread these illnesses. Now, who we spread them to, those persons we spread them to may be asymptomatic, no problem at all. Those persons may get a mild temperature, mild runny nose, sore throat, they get over it. Some people get a little sicker and then, you know, they go to the doctor, they treat it and so. But there are always going to be some cases where people get it in a bad way, in a severe way. That percentage of people is small. You want it to be small. But if you are in a family and one of your family members, doesn't matter about statistics, it's your family member. For you, it's 100%. You know, 1%, 2% is your family is 100% of the persons who are affected by somebody either dying or being hospitalized because of an illness. And once again, I am really pleading with persons that in general, we should wash our hands more. But when there is a virus about, and so we should wash it even more than more. And we should use the right type of soap. Liquid soap is probably better, you know. The reason why ordinary soap, bar soap, germs, bacteria can survive on the soap for a while, you know. And liquid soap, especially alcohol-based soap, we tend to knock these things out. It's important. Yeah, some of these things may dry out your hands and make them chappy and so, especially the female, but washing hands and So is really critical. And we can't underestimate what is going to happen. So I've said, in my view, I think this HMPV has been around. We've seen it's not new. It's not a new virus. We'll see it again next year. We'll see it again the other year. It's a little surge in China around this time. Will it spread around the world? It could do. I don't think it will. You understand? But at the same time, I could be wrong, you know? And 2, 3, 4 weeks from now, we could be all going crazy about it because it is a greater warning and so that's coming from the World Health Organization and so that might happen. But I'm really hoping they say, well, we haven't, you know, we've had cases of monkeypox. You know, some people going crazy over monkeypox. I'm glad it went, you know. Oropoucho virus, we see a couple of cases. I'm not sure we've seen any in St. Vincent, but we've seen a couple of cases in the Caribbean. People going crazy over what is this new virus, and with this HMPV, we've seen this before. It's been around. It's been in England. It's been in America. It's probably been in the Caribbean, and we will see it again in other subsequent years. Is it causing a big outbreak in the world, a pandemic? Not yet. Can it? Maybe. Do you think that it will? No. That's the thing. You know what I mean? That's the play that clear. The patterns and so forth. You know, Malaysia, 327 cases. That's not overwhelming. That's not 45 more than the previous year. Come on. You know, 45 cases more? I thought it was 45,000 cases more. No, it's not. Just 45. And this is important. I am seemingly downplaying it to some degree, but I'm more emphasizing that the virus was here last year. I'm talking about was around the world last year and was there the year before, and there's been a slight uptick in cases, a small percentage. Influenza is affecting more people, far, far more people in China than this same HMPV. You know, and we have to sound an alarm, but not to get persons to panic or to get scared of people to do all sorts of crazy things. It's more that from a public health point of view, just it's good to know, and for you to take heed, take warning, you know, you better do good, you know, and hopefully we will see this thing fizzle out until the next virus comes out, you know, and they will do. We'll see that each year. We'll see 2 or 3 viruses making their rounds. You know, we will do 2 or 3 viruses making their rounds, and that's it. There's a question there. Huh? A comment. Good night, gentlemen. Bird flu is on our watch here in the USA. Yes. You know, not only bird flu, but West Nile virus. You know, over in California, there's a whole set of different viruses over there. In Mississippi, there's a whole set of different viruses. In the Rocky Mountains, there's a virus that comes out called Rocky Mountain Spotted Fever. Up in Connecticut, and so we worry about Lyme disease, and so but definitely from an influenza point of view, you know, bird flu, or in another couple of years it could be swine flu. All these different type of influenzas are going to keep coming and recoming, a little different. You know, it's like it's coming in many different ways. Let's take this call. Hello, good evening. Yes, hello. Oh, we're not hearing you.
Yes, Doc Collins.
Not too bad at all.
Well, just making an interjection here.
Okay.
Listening to you talking about the viruses and so on.
Yes.
I said, the Senegal Indians in the history created any influenza virus?
No.
Well, I have that question. Stupid as it might sound, because I want to hear about all these viruses you talk about. How do they originate? Where do they originate from? And you're here in some of those distant lands and so on. So there's nothing you could identify with the Caribbean. Yeah?
With the what?
But you can identify. I said there's no virus you can identify with the Caribbean, meaning that it originated in the Caribbean. That's what I'm getting at.
I want to correct myself. I want to tell you something. There is a virus called the Caribbean Japanese lymphoma leukemia virus. It's called HTLV1. You know?
That has to do with what?
It is called HTLV1. It's a retrovirus. It's not the same line as AIDS, but it is a retrovirus, HTLV1. It's highly prevalent in St. Vincent and in Japan. That's what was found in the 1970s. And since then, it has spread to many different individuals. Matter of fact, there's a little video on HTLV on YouTube right now. You know? Now, I'm going to tell you something. Both my mother and my sister died of HTLV1 virus causing lymphoma. I'm going to say that as a public service announcement. You understand? I remember when my mother contracted this, she came to England, and I was a medical student at the time. And she went into the Royal Hammersmith Hospital. Matter of fact, they transferred me as a medical student to the Royal Hammersmith Hospital to do my rotations. I was there every single day, getting some of the best education ever. This is, they tried with her some of the newest treatments. I'm talking about 1980, 1981, some of the latest treatments in therapy. It failed. And so she eventually passed away of what's called a blood cancer, lymphoma, leukemia virus that's caused by a virus. So in answering your question truthfully, I had to come out with that. I'm sure that's a revelation, Dave. You know what I mean? Yeah.
Well, we live in a small country.
But I want to also tell you that there's a high percentage of this virus that's floating around persons in St. Vincent, in the Caribbean, Grenada, St. Lucia, and so forth. Most people are asymptomatic, won't have any problems. A very small percentage of them will have certain special problems. One of those problems being a blood cancer called lymphoma leukemia that usually ends up in death. All right?
Well, let me just wind up. I just want to wind up quickly. I'm wondering why a lot of these diseases of the past, if I can put it that way, that I thought would have outlived its time, and you heard about, like there was a prevalence of certain diseases. Which one come to mind? the one that affects your bones and so on. That spin bowler Chandrasekhar suffered from it. I don't know if you know anything much about cricket, but he went on to become one of the world's best spin bowlers from India.
Polio. You talk about polio.
Polio, yeah, that's right. That's what I'm getting at. But you hear about other sicknesses that seem to be resurfacing or reappearing, and I ask myself why, because at one time you thought these things had become obsolete.
Yeah, I could tell you why.
To me,
I could tell you. I could tell you why. It's because certain people, they feel it's their human rights not to be able to accept vaccines and not to be able to take treatments. There's certain persons who say it's my right if I don't want to take vaccines or treatments. And when those numbers build up, these viruses, some of them, then these bacteria have been eradicated. Like, let me tell you, the plague. You still have about 5 cases of the plague each year in the United States. Do you know that? You know, the plague, you heard of the plague that wiped out 50% of people in Europe in the 12th, 13th century?
Yes.
That's still around, but guess what? But the plague, all you need is sprinkle a bit of penicillin and antibiotics and you kill it, you know? So we know...
I know of a case
where
somebody took a penicillin injection and died instantly, almost instantly.
Yes.
At the Milton Cato Memorial Hospital.
Well, let me tell you something. Let me tell you, there are people who are allergic to aspirin. There are people who are allergic to bees. There are people allergic to this, that, and the other. There are people who are allergic to penicillin. Okay. So that
I get the message.
Yeah. And
that's why people are so that's just what the COVID caused in the country, and you can't just let that pass by without, people have to be, people get all kinds of, especially if they are knowledgeable, intelligent people. Things will happen to them that they have to question.
Dave, let me tell you, there are lots of diabetics who for years we are telling them, please cut back on your sugar. Please do it. And they feel, man, what they're telling me that I'm not going to get any diabetes until they have to have amputations and they would then ask the question, why didn't somebody force me, or why didn't somebody put more pressure on me to help prevent this sort of thing? In the same way, if somebody is saying that you need some medication now, you say, no, I ain't taking no medicine at all because I don't know if the medicine is safe. That's the point I make.
It's a thin line.
Huh?
Yeah, it's a thin line.
No, it's not a thin line. It's a thick line.
Huh?
It's a thick line. There's a thin line at all.
I was going to stress or emphasize that what I'm referring to, when you're caught in what you might call
conspiracy theories.
Well, I don't really go off on conspiracy theories.
But that's what I think you wanted to say.
No, I don't go off on that. But, science, would you say that science is always right? Science is always correct?
No, not at all. Science,
okay,
I'll tell you something. Let me tell you something. Science has been around for a long time. Science in the Romans, science in the Greek, science in the 16th century, in the 18th century, some of it was very wrong. A little bit of it was right. If they decide to put leeches on top of you, or they decide, let's treat you by bleeding you. So they bleed out half your blood and hope you get better. That was a treatment that science was putting forward at one time. Science was saying the earth was flat and everybody had to believe it. But science was wrong. So I am saying, but in terms of modern science, there's still problems, but more of it is right.
One thing I'd like to hear you speak about in the future, because there are those of us who would like to know if that's a right way or wrong way. It may have to do a lot with your Christian beliefs, teachings, what you have learned. Is euthanasia. Do you think that Simpsons and the Grenadines should have that sort of practice here? And I'll listen to you off here. Thank you for
Thank you.
accepting,
Your call.
because
We
I
always
think
do.
our country needs more intelligent, or should I have been appealing for more critical thinkers, and don't swallow hook, line, and sinker when certain people alone speak in this country. Thank you. Have a good evening.
Thank you very much. Yes, yes. Well, I tell you something. I have always aspired. I want to be more of a critical thinker. Maybe Dave could teach me how to become a critical thinker at some point in time, But we are at the end of the program. Dave has asked the question on euthanasia. Maybe we'll come back sometime and talk a little about that. I don't agree with it. And let me leave it that way. I'm not leave you hanging. I don't agree with it. But ladies and gentlemen, let me bid you a very pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street.